In fact, there's an analogy that malaria is an African problem. We don't worry about it, it's in Africa, it's happening there. But truthfully speaking, 95% of the deaths are happening in sub-Saharan Africa. So those are our people. And they have learned to live with malaria. They have learned to bury their family because of malaria. And they just live with it because no one is coming with a solution to tell them no one else should die, no child should die. So that was a personal reflection, because I know I'm also complacent when I'm traveling back home. I'm like, yeah, malaria knows me. Yeah, I'm not gonna be bothered with it. I'm not gonna take the medication. Am I the only one? No. Is there people here who travel back home and don't even bother to do the preventative care? Yes, they are, because I'm one of them. So it's important for us to think about the next way, because malaria has no borders. You can go to Africa, visit, and come back home. There are people here who are also dying. We've seen 6 people annually in the United Kingdom. I never thought about that. So I would call it basic problem that kills a lot of people, yet solutions are right within. And in terms of talking about solution to malaria, we have a Mossie-GO initiative, Africa Power on Malaria Consortium. Give it up, let's hear the solutions.
Thank you very much. I'm going to talk to you about probably a Uganda-UK collaboration on this project called Mossie-GO. So what is Mossie-GO? It's a solo-compatible mosquito repellent solution. Okay. Previous speaker has explained the problems about mosquitoes. I mean, people say, what's the most dangerous animal in Africa? It's the lion. No. Pub quiz, it's the hippopotamus. No, it's the mosquito. 600,000 people die every year. I think, interestingly, we're in a health and business community. £12 billion is lost to the sub-Saharan African community in terms of healthcare, malaria intervention, and absenteeism from work. So the productivity goes down. That's 2% of GDP growth. Think what this country could do if you could put that back. And we haven't added into that those children who are absentee from school, who don't do so well, and perhaps don't get that scholarship to study medicine and take that back. Okay. What do I press? Oh, perhaps I pointed at it. Press the right button, we learn. Okay, so there are a number of treatments. It's very interesting. In 2000, the UN put together a mechanism whereby they recommended insecticide-treated bed nets, intermittent preventative treatment, and indoor and outdoor residual spraying. Those 3 capabilities over 15 years reduced the number of deaths and cases of malaria by 50%. Unfortunately, since 2015, the numbers have plateaued and actually are slightly rising. So we need a new intervention. And that's it. We have designed, built, and tested in Uganda a solar-powered active vector control emanator is what they call it in UN, what you and I call an insecticide repellent. It works very simply. You simply rotate the vents, a fan starts to operate, it's dragging air in here over the refill coins, and it's dispersing an insecticide. Already I've protected the front row. Yeah, 4 of them in this lecture hall will protect you from malaria. It's about a 92% reduction in biting. You want to play with it, pass it around. They're coming down to see me in the exhibition. It was designed specifically for off-grid households, so we can provide a solar panel to drive it. 10 million people in Africa have now got electricity through solar home systems and solar lanterns. This was designed to be powered by a solar home system and a solar lantern. It's a very simple micro USB charger, so if you come from the city, you just plug it into your phone charger. Not a problem. How does it work? Well, it's pretty simple. You switch it on, there's a rotating fan, battery, rechargeable battery, 3 nights autonomy. So we are now protecting you from dusk to dawn. Not when you go to sleep under your bed nets, which you should be doing, but in the evening, when you're sitting round on the table discussing the day's events, and the mosquitoes are active. That's a simple overview of what it is. I think it's easier just to come down and see the product. And I said, how is this then a Ugandan issue? It's because we undertook the randomized control trial in Ginger and Bwekwe, which I probably pronounced wrongly, but I'm told if I only say Ginger, the people from Bwekwe will get really upset with me. So we undertook a 10,000 household randomized control trial. How effective is it? It's a 92% reduction in biting. 92% sounds a good number, but 90%? Come on. Well, if you take topical sprays and creams, you're protecting yourself to 70% efficacy. Light a candle, citronella candle, someone wanted natural effects, 30% reduction in biting. Ultrasonic devices, 30% reduction. 92% is a high rate. And remember, it takes 2 bites to spread malaria. The mosquito needs to get infected from an infected person, the parasite needs to develop, and only then is it transmitting. There are 2 bites. So you're 92% times 92%. What is it? It's durable, it's easy of use, as a thing it's just being passed around, it's very simple to do. In the trial, 99% of the people liked it, they wanted to continue to use it. It's low maintenance, and it's integrated with solar home systems. The cost, X works, yes, it's manufactured in China. X works about $9.50. Fairly inexpensive to ship it, and I am very pleased because I believe we have Ugandan ministers here to report that Uganda is the first country to actually register this as a medical device. So the import duty has fallen from 25% to 3%, and there is no VAT on it. We have import licenses for Uganda, for Tanzania, for Zambia, and we're in the process of applying for Malawi. We are looking for wholesalers and distributors to help us distribute it. If you're from a different country, such as Kenya, we would love to work with you. We need a company registered in the country in order to apply for the license. We can't apply from the UK. It has to be a locally owned company. It should be a locally owned company. It has to be owned by the people who are going to use it. Pack of 4 coins, that lasts 2 months. I didn't say each coin lasts 2 weeks. So you get a pack of 4 coins with it 2 months, 165. I think that works out at 1 US cent per night protection. How much do you love your kids? How does it compare to other treatments? Well, I said the 3 key ones are mosquito nets, interventive preventative treatment, and indoor residual spraying. Also are coming vaccines, although their efficacy is low at the moment. It's by no means 100% protection. Look at those numbers. $290, $5, $8.75. That's the cost per person per year of protection. Mossie-GO is $230. It's roughly the same as mosquito nets, except mosquito nets only protect you for half the night after you've gone to sleep. Not many people eat their dinner under a mosquito net. We're providing dusk to dawn. But we're not trying to displace these. It took 3 treatments to get malaria halved. We're joining our brothers and sisters of preventative treatment to try and get this down. The UN wants it eliminated by 2030. But let's just say in the next 10 years, could we halve it again? That's 300,000 lives. That's 6 billion a year that we're going to save there. Of course, you might be trying to buy it yourself and not a treatment. Well, how does it compare? You're probably used to those plug-in things. You get them, you plug them into the wall. That's fine if you've got mains power. I should point out, you plug that into your solar home system, you drain the solar home system in about half an hour. We're 1/100th of that amount of power. So as you can see, we're the lowest cost provider over 1 year. Inevitably, when you start with a new product, the capital cost of the product is high, but the refills are way lower. So you see how much improvement we get over a 1 year and 2 year costs. Progress. We've tested clinical efficacy. It was done at the London School of Hygiene and Tropical Medicine. It was repeated by the Tanzanian authorities on 2 species of malaria-carrying mosquitoes. Again, they got 92% on Gambia and 86% on Egyptii. We've done the randomized trials and registered as a medical product. So, why am I here at an exhibition? We need you. We're looking for distributors. We need to get this out now to everyone. I can't go round selling this to every single person. We need the distributors and the retailers. Yeah, wholesalers to bring it into the countries where we don't have import license. Policymakers, this should be standard treatment. It should be handed out. What about thinking about every pregnant woman being given one of these? Because the chances are she has or will have more under 5s. We're targeting the right population. Perhaps as a Diaspora we set up a charity, and in fact Lancing School, not far from here, has worked for 40 years with a school and a health clinic in Malawi. They have sent 35 students spending 5.5 weeks in Malawi, and they are challenged to find out what it would cost to give every pregnant woman a Mossie-GO that arrives in the clinics. They're visiting 12 clinics in Malawi, and we're going to try and get the schools behind us to provide those Mossie-GOs. The initiative is in Malawi because they've already got 40 years partnership. So that's it. Take questions. It was under the back. Can you shout?
My good sir,
Thank you.
first of all, your innovation and desire is novel and amazing. I've got 2 good questions. First of all, who owns this? Is it an NGO? Is it run by what? I don't know. Explain that. And also, I'll tell you later how we can help.
Thank you. Excellent. Africa Power is a for-profit company based in the UK, but we have set up distributorships which trade under the name of Cure Solar. Cure Solar is in Uganda, Tanzania and Zambia. We have a separate partner in Malawi.
And I think I'll finish with...
Which is health and business. So.
I'm a big supporter of business that solves problems.
Yep.
And you can't solve a problem without having an incentive. Is there any way to include, you know what, I'm just in awe and I'm sorry, get the mic away from me.
Yeah, I think what you're saying is doing good. Doing good can be good business.
We are building bridges of hope. Doctors, nurses, innovators, leaders, entrepreneurs reaching for the sky, investors bringing new possibilities, helping every dream to fly. Every connection is a blessing, every partnership a flame. When we lift each other higher,